So we are learning President Joe Biden now has body aches and a sore throat after contracting COVID. His doctor saying yesterday that he's tolerating the Paxlovid treatment well. Preliminary reports indicate the president likely has the BA.5 variant. Let's bring in NYU School of Medicine Associate Professor Dr. Devi. Doc, thanks so much for joining the program today. So is the president getting better? Is this normal? How serious is this variant?
Well, generally speaking, I would say that all of this is reassuring and expected. You know, you have somebody who's fully vaccinated, boosted. You have a variant that is less deadly, less powerful, more contagious, which we would expect over time, like with any virus. And he's on an oral antiviral, which seems to be highly effective. So, of course, people will have symptoms, but generally they're pretty mild. So all of it looks good, generally speaking. But there are a couple things, you know, we have an update. So the president, back in his November 2021 medical report, he used to be on a blood thinner called Eliquis, which is because he has a heart condition called atrial fibrillation, where the heart beats a little bit abnormally. That can happen in people. So he's been switched to something called aspirin, you know, for the same condition. Aspirin is also a blood thinner. So sometimes with those changes, what you wonder about is why was it changed? It's always a balance between whether it's because if somebody's getting a little bit dehydrated, between having a viral illness, between the heat wave that we're going through right now. You know, if you fall, is it because you're worried that the blood thinner could cause you to bleed more uncontrollably and you want to minimize that risk, right?
You being a doctor, do you have several follow-ups for his primary physician?
So, you know, I'm not a primary care provider necessarily, but usually for patients who are on blood thinners, you do kind of monitor them to see what's going on, if there's any other medical condition going on at the same time, because you want to balance out that risk of bleeding versus a risk of having a cardiovascular problem, which is usually what the blood thinner is managing. Then another thing to consider, especially if somebody is having any kind of viral illness, you know, as you get older, if you have different medical problems, it takes longer to bounce back, right? Any viral illness, if you're in your 20s and you get it, even mono, it might take some time to kind of bounce back from that. But as you get older, you know, things take some time, right? And with COVID, of course, we see things like long COVID. So even if you have a mild illness, sometimes it takes longer, and there are studies that show that even if you have a mild illness, sometimes the speed with which you're processing comes back, takes time, memory recall, sometimes fluency. These things can be affected. That's true for anybody, of course. So these are things to keep in mind.
Doc, I want to switch gears with you, if you don't mind. Monkeypox was just declared a global health emergency by the World Health Organization. How bad is it? I mean, the moment they declared as this global emergency, a lot of people start to get concerned. Should we?
Well, so it's of course, we have to be concerned about any kind of illness, but I do think that we have to be careful. I mean, people are fatigued after going through this whole COVID pandemic. People are also very skeptical and distrustful. So I think the World Health Organization, you know, anytime you declare a pandemic or any kind of emergency, we should say, global health emergency, it's like turning up the volume on your response, right? So what we really need is a very coordinated, targeted response. And in this case with monkeypox, for the most part, you know, there are certain groups that are more at risk. And the spread is really from bodily fluids or from people who have rashes, right? So there's a rash that's being, you know, from the spread between lesions touching lesions, or from people getting these secretions spreading between each other. So there are certain groups that are going to be more at risk. It's not necessarily the same way that COVID was being spread. So I think certain groups need to be more cautious than others. Not everybody needs to be in a panic about catching monkeypox.
Well, we always can depend on you for being reasonable. Dr. Devi, thanks so much for joining the program.
Thank you.